Hi, welcome aboard. I'm Dr. K-Train. Nice to meet you. What's your name? Okay. Have you ever had a cranial nerve exam before? Okay. And are you familiar with what the cranial nerves are? Yeah. Okay. So yeah, it's basically there's 12 nerves that connect your brain to your body and control things like sight, smell, taste, facial functions, moving those muscles, blinking, those types of things. So I'm just gonna kind of thoroughly test all that stuff today. Okay. Great, and I'll let you know which nerve it is too. We just like to keep our patients informed so that they kind of have an understanding of what's going on. If you have any concerns at any point, just speak up and mention it to me, and I can maybe check those things out too. Okay, great. So the first nerve that I'll be testing is the olfactory nerve. That's what determines your sense of smell. So first of all, have you noticed any changes to your sense of smell recently? Okay, great. So I have a few different smells. So once I hold it up to your nose, just let me know which smell you're smelling. Okay, it should be pretty obvious, hopefully. What do you think that is? Yeah, it should be coffee. Yeah, like freshly ground coffee, the good stuff. Yeah, okay. And then I have another one. What does that smell like? Yeah, it should be lemon. Yeah, okay. And then I have one more. Chocolate. Yeah, chocolate. Okay. So the next cranial nerve number 2, is the optic nerve. So this controls your eyesight. And then there's some other nerves that control eye movement, but this is just to see how well you see. I want you to just stay right there. I'm going to hold up this eye chart here. So cover up your right eye for me. Great. And then let me know what the lowest row you can read here is, and then read that out loud for me. Sorry, I'm a little shaky. I have my portable chart today. Okay, so then you can cover up your other eye and then do the same thing. Read the lowest one you can read and read the letters for me. Okay, and the important thing is, like, did you strain it all there? Okay, good. I know I always forget to I always try to see as much as I can. So again, so this is to test your peripheral vision. So I want you to cover up one of your eyes again. And I'm going to move my finger in from the outside of your vision. So just let me know when you can see my finger, okay? Yep, cover up your eye. Okay. Okay, now you can cover up the other eye and then we'll do the same thing. Okay. And let me know too if you experience any sort of double vision during any of these tests, especially when we get to some of the focusing ones. Okay. So the next ones are cranial nerves 3, 4, and 6. It's the oculomotor, trochlear, and abducens. And those handle your moving your eyes up and down, blinking, those sort of things. So we'll be testing that next. Okay. So I have this pen light. I'm going to turn it on. And what I want you to do is focus on my nose. And then I'm just going to move this light so I can observe your pupils. Ready? All right, so I'm going to hold my pen light here. This time it's off, but I do want you to focus on this. So I'm going to hold it here, and then I'll move it close to your face. I want you to just focus on it the whole time. Keep your eyes fixed on this. Okay, ready? And follow it as best you can. And follow it as best you can. and follow it as best you can. So I have another pen light here. I want you to follow it again, but I'm going to move it a little bit more regular rather than from far away to close up. I'm going to just kind of move it along your vision. So again, I want you to focus on this as much as you can. Okay, ready? Okay, and now I'm going to turn the light on, and I want you to follow the light as I move it. Ready? Okay, great job. The next nerve is the trigeminal nerve, so it handles the feelings in your face, your cheeks, your movement of your jaw, things like that. Okay? And have you noticed any issues with any of those things I mentioned? Okay. Yeah, sometimes like if you grind your teeth at night, that can cause issues with your jaw. And with those, usually it's a dental issue, so you can talk with your dentist um, rather than being a nerve issue. So for that, usually they would give you a mouth guard or something like that. Yeah, it happens, especially if you're stressed all the time. It happens to me too. Don't worry about it. It's perfectly normal. So first of all, is it okay if I touch you? Okay, yeah, for this one, we do a little bit of touching, and there's a few others as well that I'll be doing kind of similar things. So I just want to make sure that's okay and that you're comfortable. Yeah, okay. So for this one, I have two different softness levels of things, and I'm going to touch your face with it. So I have this soft Q-tip. So this is what it feels like. Does that feel soft to you? Okay. And then I have this, it's just a little like blunt tip, but somewhat sharp. So it's supposed to be kind of like a sharper feeling. Okay. So what I'm going to do is I want you to tell me which feeling you're feeling, if it's the sharp or the soft. And I'm doing kind of on both sides. If you notice a difference in sensation, just let me know. Sometimes that can be a sign that maybe there's something wrong on either side. And then if you don't feel the sensation, please let me know as well. Yeah, okay. So I want you to close your eyes for this part too. Yeah. Okay, so are you feeling soft or sharp? Yep. And soft or sharp? Okay. And soft or sharp? Yeah. And soft or sharp? Okay. So I'm going to do that in several places on your face and on both sides. Okay. Is that soft or sharp? And is that soft or sharp? Mm-hmm. Great. And did anything feel different between your two sides? Okay. That's perfect. Okay, so now I'm going to test your mandible, otherwise known as your jaw. So can you first just clench your teeth for me? And then I'm going to feel just underneath, if that's okay. Okay. Yep, keep clenching. Yep. Okay, so now I want you to open your mouth and just move your jaw from side to side with your mouth open. Like that. Yep, a little bit more. Great. Okay, you can close your jaw now, however it feels comfortable. All right, so next we're going to check your facial nerve. So first of all, let me just look at your face. We kind of just check to make sure your features look symmetrical. Okay. Okay, yeah. And then, so I want you to do a few things. Well, I'll have you do them just normally. Then I'm going to apply just a little bit of resistance. So, for example, I'll have you raise your eyebrows. You can do that normally. And then I'm going to just provide a little bit of resistance to make sure that you can do that as well. Okay. All right. So, raise your eyebrows for me. Okay. And then raise them while I provide some resistance. Okay. Good job. Okay, now I want you to close your eyes really tightly. Great. So I'm just going to provide a little resistance, try to hold them open. Okay, close them tightly. Great, good job. Okay, now I want you to puff out your cheeks. Okay, I'm going to provide a little resistance. Okay, yep, still puff out your cheeks. Great job, great job. Okay, now I just want you to give me a big smile. Lovely. And then again, I'm going to just provide a little resistance, so continue to smile. Great job, great job. Yeah, keep on smiling. I like your smile. All right, the next one is the vestibulocochlear nerve. You might have heard of cochlear implants, which help with hearing. So this nerve helps you with hearing and then also with balance. So with a cranial nerve exam, typically we don't test for balance, but if you have issues with balance or are worried that you might, we can do further testing at a later time. Just let me know. It just takes a little bit more than what we're able to do in this test. Okay, yeah. So what I'm going to do is I'm going to move close up and whisper in your ear. And I want you to just repeat the words that I'm saying to you, and I'm going to do it in both ears, okay? All right. Licorice. Okay. Chicken noodle soup. Yep. New York City. Okay. Crocodile. Cinnamon Toast Crunch. Olive juice. Grilled cheese. I can't think of anything besides foods. I must be hungry. But you did great. Good job. And did you notice any difference in hearing between your right and your left? I know they all kind of blend together, right? So next is the glossopharyngeal and the vagus nerves. So these handle taste, swallowing, digestion, heart rate, that sort of a thing. So the nurses did check your heart rate before you got in here with me. So we'll mostly just be checking your swallowing with this. And then again, with digestion, that's something that we can't really do with the scope of this exam, but we can do later if you're concerned about that. Yeah. And then we also don't have taste today. But again, if you're concerned about that, we can do that separately. Okay, so now we're just going to kind of check swallowing and how your throat kind of looks. So if you can go ahead and cough for me, can you do that? Yeah, just really little. Okay, do like a little bit bigger cough too. I know my example was a little small. Okay, great. And then I want you to say ah and open your mouth wide for me. Okay, yeah, keep saying it. I just want to look at the back as much as I can. Okay, yeah, it looks good. Okay, and then I'm just gonna feel your throat. So can you just swallow for me like I just did? Kind of just, swallow a little bit back there, and then I'll just feel around when you do that. Okay, you want to swallow it one more time? Okay, yep, feels great. All right, so next is the accessory nerve. Or sometimes it's called the spinal accessory nerve. So one thing I'm going to do is I'm just going to hold your head in place, and I want you to, against my resistance, turn your head from side to side, and then I'm going to do the same with your shoulders, and I want you to shrug. So let's start with the head. I'm going to hold that in place, and then just turn from side to side if you can. Okay, and then I'm going to push down on your shoulders, so shrug as best you can. Just like lift that up. I'm just going to put a little bit of resistance there. Okay, good job. Yeah, sometimes it feels good to just, stretch it a little bit. Okay, and then this next one, actually it's number 12, it's the last one, is the hypoglossal nerve. So that controls your tongue. So I want you to just open your mouth for me so I can look at your tongue. Okay. And then what I want you to do now is stick out your tongue as far as you can. Okay. And then just move it from side to side so I can see that you can kind of control it that way. Okay. Yeah, I know it's a little weird. Okay, and all good. Okay, and how do you feel that test went? Did you have any questions or issues that you might want to ask or go over? Okay, yeah, no problem. No problem at all. Yeah, all right, have a great day.